You overheard a white-coated phlebotomist talking to another patient while waiting for a result. "This will go straight to the lab," she says, and you vaguely picture a room full of dark countertops crowded with test tubes and microscopes. But in reality, most hospital laboratories are major departments comprising multiple areas such as chemistry, microbiology, hematology, virology, histology, and the blood bank. Today, highly automated labs process hundreds of samples a day as medical laboratory scientists sort panic values from routine results. But unlike doctors and nurses, their essential work is done out of public view. Medical lab scientists culture just about every spot on the body you can think of and every fluid, including some you might not realize you had. Less common exams include pericardial fluid, pleural fluid, amniotic fluid, and synovial fluid. Clinical chemistry is generally concerned with analysis of bodily fluids for diagnostic and therapeutic purposes. Most tests are done on serum or plasma. Large arrays of tests are performed, such as general or routine chemistry, which is commonly ordered blood chemistries for liver and kidney function tests, special chemistry like electrophoresis. Immunology and serology focus on identifying antibodies and investigating problems with the immune system. Clinical microscopy performs scientific analysis of non-blood body fluids such as urine, semen, and stool. Many illnesses and disorders affect how your body removes waste and toxins. Routine tests are done inside these sections such as seminalisis, pregnancy test, fecal occult blood test, urinalysis using multiple reagent dipstick, and urine analyzers that detects and quantify salts and analytes. And of course, the test that awakens your sense of smell, the fecalysis. In hematology, some specimens require further analysis. For instance, the complete blood count. Microscopy might be done when values are very abnormal, in which the scientist stains a drop of blood that's spread on a slide and examines it for abnormalities such as sickle cell or leukemia. The first person to recognize leukemia is the person who's been sitting there looking at that slide. A histotechnologist is someone that is part of a medical laboratory team that works with human specimens to diagnose disease and abnormalities. Their main function is to prepare tissue samples for analysis. This is a complex process and involves putting the specimen through a variety of preparatory steps. These steps include staining, processing, trimming, and other techniques that require scientific skill set. To achieve accurate testing, the histotech must have the skills and training to perform complex scientific testing. Blood banks perform testing to determine blood type of patients and to identify compatible blood products along with battery of tests and treatments to ensure or enhance quality. Routine blood storage is 35 days for packed red blood cells, which is by far the most commonly transfused blood product that involves refrigeration. Platelets may only be stored for 5 days due largely to the greater potential of contamination. Fresh frozen plasma and cryoprecipitate must be stored at negative 30 degrees Celsius. As storage time remains the only available way to estimate quality status or loss, a first-in, first-out inventory management approach is standard presently.